I'm a very high-tech doctor. I have a CBCT in my office. I have been using a CEREC user for 10 years. I strongly believe in technology. I'm not afraid of investing in technology that I know is going to work, it's going to deliver, and it's going to be better for my patients. Once I got my laser, I start offering to my patients. All those patients that declined conventional surgery, they were boom, 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 ready to move forward with the laser. It just increased my practice because I don't do conventional surgery. Why? Because I never like it. So I always would refer out all those patients for conventional surgery to the periodontist. Now all those patients stay in my office and we're doing LANAP, which is even better than conventional surgery. So for the point of return on investment, it has no questions. I have to tell you, it's a very simple procedure when you look from the, we were taught at school how to do extraction of wisdom teeth and root canals. So, but LANAP surgery, if you follow the steps, it's a very simple procedure. So any general dentist can do it. And it's easy. Once you finish your training, you get back to your office and you're ready to do it. I think that every single general dentist should have the PerioLase, because we are the first ones that see the patients. We are the ones that can treat the periodontal disease in the initial stage, moderate stage. Usually, most of the time when a general dentist refers a patient to a periodontist, usually with, there's nothing else to do, take the teeth out, place the implants. So I think that we are that person that needs to be there to walk that patient through the process. And I use it a lot. I use my laser for pocket disinfections. After every period maintenance, if patient still has some bleeding here and there, we use it. I use it for other surgeries. But I'm really periodontal oriented. I'm one of the general dentists that you come to my practice, and periodontal disease is really in the top 5. I'm a restorative dentist. I do a lot of cosmetic, but I cannot do that if my base is not correct. So that's why it's so important. And I think every general dentist should have that technology, because you're going to deliver to the patient the best treatment options that they can have. One of my very first patients, she came to me, I would say 4 or 5 years ago, with a very advanced periodontal disease. Of course, I referred her to the periodontist, and of course, conventional osteosurgery was indicated. She denied it. She didn't want to do it. She didn't want to lose some of her teeth. She didn't want to have longer teeth. And she understood she had periodontal disease and what that represents for her. But she kept procrastinating, not because she didn't want to treat it, but because of the consequences of the surgery. She was afraid of the pain. So as soon as I finished LANAP, I went back to my office, and voila, 2 weeks later, she comes for perio maintenance. So I sit down with her, I said, you know what, this is the solution for you. It's no pain. I explained the whole procedure, what we're regenerating bone, and I said, this is really your answer. Sure enough, next week she's scheduled for surgery. With this surgery, I did half the mouth, half the other week. She came for follow-ups. Then one day she came, doctor, my mouth feels better than ever. And even my bite, when I bite down, I feel that I never bite before the way I do now. She's still in the 6 months, so we're waiting for the results. But so far, what we have seen in soft tissue and color pigmentation and the way she feels is just unbelievable. She's very happy. I'm very happy. We're very excited to look for the results at the end. So everything is working really good. And patients like her, we have a lot. I'm a general dentist, so I'm the first line for patients. Patients came to me, and I'm the first one who diagnosed periodontal disease. So my goal is to try to get those patients before to get to that stage. So, but for her, since she didn't want to go to conventional surgery, I think that once she saw this, her eyes open like this, and I say, I'm in. I want to do it. This is what it is for me.